Good afternoon everyone, my name is Steve Jones, as Anthony says. I'm an academic at the University of Manchester. My research area is really higher education itself, so I'm interested in who goes to university, who doesn't go to university, how some people get into university. So when Anthony gave me a ring and said he had this project lined up which was going to arrange work tasters in the NHS, give young people experience, short bursts of experience in the NHS, I was very interested to be part of the evaluation because I was interested in how they would use that in order to further their careers, whether they would go to university, whether they reflect positively on it, and what other stakeholders have to say about the issue. So I'm going to talk to you about some of those things now. As Anthony says, it's joint authored work that involves me, Anthony, Ellie, and Rachel. Okay, so the kind of evidence we're interested in, my title is How Access to the Medical Profession is Conceptualised by Key Stakeholders, evidence from this case study of NHS work tasters. And when I talk about evidence, what I'm thinking of is two kinds of evidence that relates to practice and evidence that relates to theory. So in terms of practice, we're interested in the systems and structures that work for all stakeholders in terms of facilitating this kind of work experience. We're interested in how information can be presented in a very clear way that young people can understand, and we're interested in this equitable distribution of opportunity. We know at the moment that there isn't always an equitable distribution of opportunity when it comes to work experience, and so we're interested in how that can change in practice. And in terms of theories of work experience, one of the things that me and my colleagues are interested in is whether we can abstract in any kind of way and look to see whether there are any overarching patterns when it comes to the different practices around work experience. So we know that there's human capital that's developed, i.e. employability skills. We know that work experience brings social capital, things like contacts and networks, connections to people in the know. We know that that matters a lot. And we know that there's cultural capital, by which I mean self-confidence, self-belief, insight into the game, as some people describe it. But what we don't know is how these things link into one another, and we don't really understand how work experience is able to equip, or fails to sometimes equip, young people with these kind of skills. Okay, so the research context that we're operating in very simplistic terms, can be summarised as follows. Here are the things we know. We know that young people struggle to access the kind of employer engagement activities needed to enter leading universities and top professions. We know this from reports by the Social Mobility and Child Poverty Commission, reports by the Sutton Trust. And we also know that access varies according to school type and socio-economic background, as some of the questions for the previous presentation signalled. There's quite a lot of research in that area as well. Okay, so the case study that we chose, or the case study that offered itself for evaluation, was the NHS, which was perfect in many ways. The largest healthcare system in the world, employing around 1.6 million people. We know that medical students are disproportionately drawn from wealthier backgrounds because there are plenty of studies that tell us this. In fact, and I was a bit shocked when I did the research and found out some of the stats here, we know that 80% of medical school applicants come from 20% of the country's secondary schools and colleges. And in fact, half of the country's secondary schools and colleges don't provide a single applicant to medical schools at British universities. And that's according to the Medical School Council. And we also know, as someone mentioned again in one of the questions, that there are stereotypical views here and stereotypes that need to be broken down. And there's a lot of research by Greenhalgh and others which talk about the medical profession as being particularly susceptible to stereotypes which can deter entry. So for these reasons, the NHS makes an excellent case study. The NHS is also interesting because access to medical schools is so important, and some of the key research here comes from the Employment and Education Task Force. So Anthony co-authored a piece in 2011, which was desk-based research into what Russell Group universities are looking for, and they overwhelmingly want medical schools to have relevant work-based experience. 88% of Russell Group universities said it was desirable or essential. And when you look on websites at top universities, they're often very strong in the way they express this. So one Russell Group university says, "We expect applicants to have a range of work experience. It's important that you have an understanding of the complex nature of the doctor's role, as well as being aware of the highs and lows of the profession. Work experience is important in enabling you to develop and demonstrate that you have relevant skills and qualities that are essential to becoming a good doctor. That's a big ask in many ways, to understand the highs and lows of the profession. Remember that when young people apply to medical school, they're often only 16, 17 years old when they're writing their personal statement. But so to be able to demonstrate that they have the relevant skills and qualities requires more maybe than applicants from other courses. Okay, so the pilot study involved 18 work tasters. These were episodes of job shadowing that lasted between 1 and 3 days, and we complemented this delivery of the work tasters with surveys, substantial stakeholder surveys, because we really wanted to know how people think around this issue. So the stakeholder surveys involved surveying 700 members of state school staff, which represented about 1/5 of all English secondary schools and colleges. This was quite a wide survey that was undertaken. We also spoke to or had responses from over 1,000 medical students, of whom over 90% were under 30 years of age, so they've been through the system very recently. And we interviewed over 300 NHS staff members, current members, and they were evenly split between clinical and non-clinical professions. I'm going to talk to you about what they said in a moment. But basically what we're trying to do is triangulate our methods with these three groups so we had an overall picture of what the situation was like and whether the kind of intervention that we proposed, the work tasters, was going to be a good one. And of course the other evaluation we wanted was actually from the young people themselves. So we've made sure we interviewed the young people at 2 or 3 times during their year at school, their academic year, to see what they made of the work tasters. Okay, some stats to begin with. When we asked the school staff, people who worked in school, how easy or difficult is it for your students to find work-based experience that allows them to gain insights into what working of the NHS is like? We got 670 responses almost, and the breakdown was as follows. As you can see, it's a very extreme distribution. Only 0.4% said it was very easy for their students to get work experience. 2.8% said it was fairly easy. About 8% weren't sure, but 43% said it was fairly difficult and 45% said it was very difficult. So we had overwhelming evidence of what we may have intuitively expected, that it's really difficult for students, for young people, to gain authentic experience at the NHS. For some people it was about social capital, and by social capital I'm interpreting this broadly here, meaning who you know. That's how you get the experience of the NHS. So one current NHS staff member said to us, the children who managed to get work experience with doctors seem to be 95% from private school with a parent or a parent's friend who's a doctor. And we found this emerging a lot with the medical students and the NHS staff, that they managed to get their experience because of having very close relations to people who were in similar jobs. Another said, it's more that I found it easier to apply to medical schools because my dad's a doctor, so I know what kind of things I needed to say on my personal statement because he read it through several times. And I've also done quite a lot of work on personal statements, and I'm very interested in the kind of advice and guidance and help that people from different backgrounds are able to draw on. Social capital for some, but for others, it's serendipity. They managed to find someone who they knew who could give them the advice, but it was often a distant relation or someone they encountered by luck. So one NHS staff member says, well, I was lucky, my aunt was a radiographer and she arranged for me to spend time with other radiographers so that I could show some experience at the NHS. I'm embarrassed to say that before that my expectations came from episodes of Casualty. Now this wasn't unusual, this student wasn't the only one to say that Casualty, the TV show about hospitals, was actually the main source of information for them because they were unable to draw on any more direct or reliable sources. Another current medical student says, most helpful for me was job shadowing in radiography, which was quite fun, and it was arranged through my grandma's friend's daughter, and here you can see the kind of tentacles and networks being stretched even more. And the last one's our favourite. My brother's football teammate's dad was a pathologist at the local hospital. He let me shadow him for the morning and took me around the labs, the mortuary, and talked to me about the career path. So what we're finding is a lot of people who get into the NHS who don't have the social capital are doing it through serendipity or through very tenuous contacts that they manage to form. The role of schools was an issue that we're interested in looking at in some detail. Some medical students and people who worked in the NHS were really quite critical of schools, and one said, I'd say my secondary school was probably my biggest burden. They had a lack of insight and resources to provide support that more privileged schools have. What was interesting is when we spoke to the people in the schools, they didn't really disagree. So the general message we got was one of agreement. One member of the school staff said, well, work placements in any medical health related field is almost impossible to get. Students are up against hundreds of other students, and often what happens is those with parents who are in the field or who know people get the placements, and our children's parents don't know anyone, so huge barriers. That was a reflection of the school. So there was actually agreement on what the problem was in that respect. When we said to the medical students, when considering your own career aspirations, did you know anyone, a friend or family, who worked in the NHS and could give you trusted and useful advice? We got over 800 responses, and this was a distribution. I've broken it down here according to whether the medical student went to a non-selective state school, a selective state school, or an independent school. And you can see there are significant differences. For those who went to an independent school, only 1/3 said they didn't know anyone who could give them advice. But if you went to a non-selective state school, that goes up to a half. So half of them couldn't get any advice. When they did get advice, there were also a difference. So if you went to a non-selective state school, we said, did you know one person or more than one person? And the distribution between those from non-selective state schools was very even. But amongst those from independent state schools, if you did know someone, you were twice as likely to know more than one person than only know one person. And given what the previous study explained about the quantity of these kind of, well, career talks in the previous case, but the quantity of ties being exponentially important, it's significant, we thought, that students from more advantaged backgrounds often have many more contacts to draw on. And the teacher perceptions of pupil access to trusted sources of trusted and useful advice, we can also reflect it like this. This graph basically shows along the bottom axis the proportion of students in the teacher's school that qualified for free school meals. So down at that end, it's very low, so there you have more well-off students, and at this end, it's over 50%. So they have lots of students who are claiming free school meals, and we've matched against that axis the number of staff who said their students have not much or very limited access to trusted advice. And as you can see, there's a clear distribution. So the more students there are in free school who claim free school meals in your school, the less access they have to trusted advice, according to the teachers. Okay, so the work tasted pilot was basically very well received. It was short periods, just 1 to 3 days, in groups of 1, 2 or 3 pupils. They were all 16 plus, and we arranged for them to shadow 2 or more NHS professionals. 18 pupils took part in it. We found that demand was considerable because it represented new and better access to workplace experiences. We found that it was high in value, it was very useful in HE applications, it was reportedly good in terms of career decision making, and it was more helpful on average than traditional encounters of work experience. I'll explain why in a moment. Delivery was strongly valued as an alternative to reliance on family network. People are very aware of the role of family network and welcomed something that didn't rely on social capital. And we found broad support for a possible online self-matching system which would allow schools and NHS professionals, almost like a dating site, to make contact with one another in order to set up work tasters. So what do young people value most about their NHS experience? Well, the interesting thing that came top was authenticity, and this came through in both of the papers that we've had so far today. So authentic insight into the reality of working in the NHS was number one. People said it was good to see a variety of NHS roles. People mentioned the connections they could make to meet people, to talk to new people. For some, it confirmed career aspirations, and some connected it to university application processes as well. So one student said, I gained an understanding of what doctors actually did and how the NHS functioned. I felt before this, it was all like a big black box. Students really reported feeling as if they didn't know anything about the NHS until they were able to get some kind of insight. One said, it gave me genuine insights into the realities of the NHS, particularly in a struggling hospital. It allowed me to enter medical school with my eyes very much open, under no illusions that what I was going into was easy or glamorous. Another said it was upsetting and shocking, but rewarding, made me think very seriously about pursuing a career with medicine and whether I was cut out for it. Another said, wide variety of experience, which were the real thing, not the diluted experience for teenagers. One of the replies actually said, it was really great. I saw blood. It didn't elaborate. I don't know whose blood it was, but it was definitely reported as a positive. And it's the idea of authenticity. They don't want a kind of Disney-fied work experience process where they see a version of the workplace which is being sold to them and maybe doesn't reflect reality. They actually want to see the everyday reality of the workplace. Medicine, one of the someone who'd experienced work experience said, medicine no longer felt like a distant aspiration, it was something I had a chance of getting into. So this is why it's important for young people to have these opportunities. When we asked the school staff what was most valuable about the NHS experience, job shadowing was really important. School staff thought this was the best way of going about it. They thought it was better than work experience, volunteering. One said students really get the opportunity to visualise the reality of the workplace. Even in work experience, the tasks can be artificial. Shadowing a profession with the opportunity to ask questions is hugely beneficial in swaying a young mind either way, thus ensuring more valid choices are made. Another one says, the value of a programme like job shadowing is that it removes barriers that exist for some children who may find it difficult to secure their own placement due to a lack of opportunity or because they don't have the family or social networks. Work experience should be available to all, not just to the gifted or highly academic. So the school staff were very positive about this. They realised the limitations that their students had. They realised there was a limit to what they could do, and they welcomed the opportunity to have an encounter that was short term, that was effective, that was valued, and their evaluation was very positive. So I mentioned before that I was interested in the practice and the theory of this kind of intervention. So just to mention a few conclusions in terms of practice. Well, 90% of the school staff felt access to work experience in the NHS was currently difficult or very difficult to access. School staff were united about this. It was a real problem. 82% said they felt confident that a job shadowing programme would be popular amongst pupils, and the ones that we managed to get onto the programme who evaluated it, they evaluated it extremely positively. And 75% of the medical students strongly agreed that job shadowing would be helpful in UCAS applications, which is something the young people weren't necessarily aware of, but because medical schools in leading universities particularly set the bar so high and often have so many applicants, that to have this kind of direct work experience really would make a lot of applications stand out. In terms of theoretical conclusions, Anthony and I and Katie Morris published a paper earlier this year in the Journal of Education and Work, where we argued that the different kinds of capital that accrue from work experience are interconnected. They're cyclical rather than they're discrete and separate. So in other words, if you get the cultural capital, you get the personal confidence, you get the academic motivation, then that can often lead to the social capital because you start to get the access to employment, you get the authentic guidance, and that in turn becomes human capital being the actual skills which you get from knowing people who do the job. So we were trying to argue that the whole thing's cyclical and complicated rather than simply piecemeal. So therefore, because it's like a merry-go-round, if you're on the merry-go-round, then once you get one bit of capital, you accumulate more and more. And of course, if you're not on the merry-go-round, because, for example, you've not got the social capital to get on the carousel to begin this, because you don't know anyone, then it can be exponentially alienating because you don't manage to benefit in any other ways and other students race ahead. And we found this in the data quite a lot, particularly in the evaluation. So the last quote I'm going to give you is just from a medical student who said, the knowledge of how to play the game to get into medical school was something couldn't be known to everyone I was in contact with at the time. So I had to figure it out for myself. And in this respect, I was always behind the curve. Getting work experience was extremely difficult. I wouldn't have been able to do it if it wasn't having a tenuous contact in a hospital. Now I picked that one out because it seems to capture really what we found across the board. Often for young people who didn't have the social capital, it was a tenuous contact that was necessary, but once they were able to identify that tenuous contact, they were then able to spin around the cycle a bit more, develop their skills through the human capital, often grow enormously in terms of cultural capital because they have different kinds of confidence, different kinds of skills, and then benefit again because they know other people. But it was very much based on these tenuous contacts and serendipity, and the knowledge of how to play the game therefore only really emerged once the different kinds of capital started to spin. Okay, I think I'll leave it there. Thanks for listening.